On your first day as a nursing student at the Nurse-Managed Wellness Center, one thing you'll encounter is the Policy and Procedure Manual. In here you can find information on medications, bed bug procedure, and screening tools such as this fall risk assessment right here. Before you go on your first home visit, there are some important things you'll want to bring along with you. First thing is your chair, which is for the patient's safety. The second thing will be your equipment bag, which contains a blood pressure cuff, hand sanitizer, gloves for your home visit, your equipment kit, assessment kit, and then you want to make sure that you bring along your patient's chart.
Before we do any assessments with the patient, we must establish a rapport with the patient, especially with the first meeting, before we can get into any medical conditions and problem solving. Okay. Hi, my name is Megan. I'm a nursing student from the Nurse-Managed Center. Can you tell me what your health problems are?
I was just released from the hospital with heart failure.
Okay, before I begin my assessment, can I ask you some questions about your health history?
On your first home visit, you're going to want to make sure you bring these forms. The first one is going to be the Nurse-Managed Center Participation and Permission Confidentiality Statement. You're going to have your patient sign that. The next form that you're going to go over is going to be the admission assessment. That includes medical conditions, past surgeries, family history, and then it also includes things like screening tools and immunizations. The next form is the medication list, and this includes the date, medications, generic name, trade name, dose, route, and frequency. And then the last form is going to be the student report for patient visit, and we're going to go into that now. So some of the things you're going to do is going to be vital signs, which includes blood pressure, pulse, respiration, and temperature. You're going to want to assess pain. Next, you're going to want to assess the respiratory system, cardiovascular, GI and abdominal, GU, developmental stage, neurological, musculoskeletal, integument, sleep patterns, their knowledge base, safety and environment, ADLs, IADLs, current community resources, and those that are needed. You'll go through the medication reconciliation, so you'll make sure that what they have right now matches this list, and then teach back.
So our job in the nurse-managed centers is to do an assessment so that we can make the right decision about what to do with the patient. And we work with patients oftentimes that we don't have medical history, past medical history, and we have to work off of the symptoms that they come with and do a thorough assessment that includes health history and physical assessment, but that is specific to particular systems based on the symptoms that the patient presents with.
Hello, Megan. Can you tell me why you're in here today?
Well, I woke up this morning and I was really clammy and I felt really lightheaded and I threw up and my stomach's been feeling weird ever since. It hurts right here.
Can I ask you a couple questions before I take a look?
Sure.
All right. How many times did you throw up this morning?
Twice.
And when was the last time you ate?
Last night around 9.
And what did you eat?
I had some ice cream.
Have you drank alcohol recently?
No.
What medications do you take right now?
I take insulin for my diabetes and metoprolol for my high blood pressure.
Has this ever happened to you before?
Not for years.
And what did you do in the past?
I went to my doctor and I think he gave me something.
Have you talked to your doctor about this?
No, I thought I'd come in here first since I know you guys are down here and see what you think.
And just one last question. Is there a possibility of pregnancy?
Oh, no.
Okay.
So Christina has done the health history, asking questions to get additional information about the symptoms that Megan presented with. Now she's going to do the physical assessment and the portions of the physical assessment that are appropriate to these symptoms. So she'll check Megan's temperature, her skin, listen for vowel sounds, do abdominal assessment in the way you learned it in health assessment, and then go over her assessment findings with her clinical faculty.
Well, Megan, it looks like you have a temperature. I talked to my professor, and I think it'd be best if you got in and see your doctor today. Can I help you make that call?
Sure.
Okay.